Today, I spoke with a former insurance executive for his take on this. Joining me now is Wendell Potter. He is the president for the Center of Health and Democracy. And, sir, as you are aware, there's been quite a bit of a health scare to a lot of people who depend on emergency health care services. And that scare, if you will, is coming from a health insurance, UnitedHealthcare. They were announcing that they were going to stop covering certain emergency room visits, but now there's a pushback, and because of that pushback and a wild outcry about this, they are now delaying that. Tell me, on the surface, when you see companies do this, particularly given the fact that we're still going through a pandemic, what goes through your mind when we see giant health insurance companies like UnitedHealthcare and other companies do this?
They're doing it for one reason and one reason only, and that is to increase their profits. And I know this because I worked for big insurance companies for 20 years, for Humana and Cigna. I handled financial communications for Cigna for 10 years. So I know why these companies make decisions like this, and it is to maximize profits. When you are looking at emergency department visits retroactively and making a decision that the reason this person went to the emergency room, it turned out not to be an emergency, so they're not going to pay for it, that is scary as heck. And it should not be lawful, because people might, and they will, with this policy when it goes into effect, be hesitant about going to the emergency room when they have a true emergency. I mean, just imagine if you are suffering from symptoms of a heart attack and you know you probably should go to the emergency room, but you don't because you're afraid, well, if I get there and they say it's not, I'm going to get hit with a big bill. People are going to die, and companies like this could not care less. It's all about the money.
Yeah, and under this new policy that the company has proposed, they would be able to scrutinize the medical records of its customers' visits to emergency departments to determine if those hospital visits should be covered by the giant company of UnitedHealthcare. Now, your response is that people can die from this. Does it stand to reason, then, that the Affordable Health Care Act should not be tampered with, since so many people, especially people of modest means or even people below the poverty line, have to rely on this kind of insurance to have something to cover them?
Well, the Affordable Care Act needs to stay in place. There's no doubt about it. It needs to be improved. There are a number of things that the Obama administration, Congress, when they wrote this bill, didn't anticipate. They didn't anticipate just how anti-patient and anti-consumer big health insurance companies would become. But since that bill became law, insurance companies have thrown up all kinds of barriers that make it more and more difficult for people to get the care that they need and can afford. And this is just the latest thing that they're doing. United is actually not the first company to announce this policy. Anthem, which is another huge for-profit insurance company, has done the same thing. And it should scare us to death, and we should be up in arms about it, and Congress should do something about it, and so should state legislators. Because when I say they've thrown up barriers, they make it more and more difficult for people to meet their deductibles because deductibles are too high. Their networks of providers have gotten to be inadequate, and they often are having insurance company bureaucrats second guess or overrule decisions made by doctors. It's called prior authorization. And this is just kind of an extension of that practice. They will have bureaucrats within the company making a decision subjectively that, well, this wasn't a true emergency, so we're not gonna cover it, and that means that the patient will have to figure out how to pay for it. It's unconscionable.
And that, Mr. Potter, is very dangerous indeed. What would be your message to the Biden administration? And furthermore, what does this do in terms of racial equity for health care, since many black and brown Americans would have an exposure to a lot of exorbitant health care costs skyrocket on them when they badly need it?
Yeah, for the Biden administration, it's start paying attention to the way that these insurance companies do business. And if you are serious about fixing the problems of the Affordable Care Act, this is a big area to address. I mentioned high out-of-pocket cost, and this will result in a lot of black and brown people getting more costs shoved back onto them from their insurance companies. Black and brown people are especially disadvantaged because of high deductibles, for example. A study out of Boston University recently found that black women who are cancer survivors are less likely to be screened and treated for cancer than people who are white. And that is because, in many cases, they don't have the money to cover their deductibles, so they are reluctant to get the care that they need. The same is going to be true with this change about emergency visits. Black and brown people are going to be especially hesitant about using the emergency department. Unfortunately, we still have a country in which black and brown people make less money. So communities of color are going to be more adversely affected than anybody else.
Well, Mr. Wendell Potter, hopefully the President of the United States will hear your clarion call and have his administration do something about this in order to keep these companies from actually making these kinds of decisions that hurt people everywhere when it comes to health care. Wendell Potter, President for the Center of Health and Democracy. Appreciate your time, sir. Thank you so much.
Thank you, Kelly. Thank you very much.